Hello, I'm Andy Bilson, and it's a great pleasure for me to have been invited to speak to you today. I'm so sorry that I haven't been able to come along and would have loved to have been in Chile with you. Um, I suppose it might be good to start with a little bit about my background and who I am. I'm a social worker with over 40 years of experience, and in the UK I was very involved in work in the juvenile justice system, where we helped to reduce the numbers of children, mainly adolescents, who were in the care system from 14,000 to 700 in a 7-year period. Beyond that, I was involved in managing services at a senior level in several local authorities and in the NGO sector. Um, I, I was director of the Council of Europe's Observatory on Children's Rights, and that led me to get involved in working internationally. And I've been working internationally for over 30 years in 30 or 40 different countries, mainly around either developing social work or around trying to provide alternatives to institutional care for children. So it's a great pleasure to be involved in this conference. I'm just sad that I wasn't able to come along. Today, what I want to talk to you about is trends in high-income countries and their implications for Chile and Argentina. There's many things about what's happening currently in the UK and across the world that make me think that you should think very carefully about what sorts of programs you emulate in your attempts to bring about this important change in Chile and Argentina. So I'll start with some international trends, and these, I'm afraid, are rather depressing. First of all, there is what I've called an investigative turn. This has left child welfare across the English-speaking world in particular in crisis, though the numbers of children in care and the costs of child welfare services is going up in most high-income countries. So what do I mean by an investigative turn? It's that what we've seen is a huge increase in the numbers of investigations that are happening. Children are more and more often being drawn into an investigation looking for evidence of harm to them than they are, as they were in the past, to receive help and guidance. So what are the trends? Here in English-speaking countries, you can see very high increases in the numbers of investigations. So in America, where investigations were already high, they've gone up by 17%. In Canada by 74%. In Australia by 42%. And in England by a whopping 158% in about 10 years. So huge increases in the numbers of investigations. And what that means is that families are put under considerable stress. Now, you might think that this focuses in on just a small number of children, but there are now long-term studies that start to give us a picture of how many children have been involved in the child protection system over time. So what you see in the figures there is that in the USA, 37% of all children have been investigated for child protection before the age of 18. In Australia and New Zealand, it's a little lower, but still 1 in 4 of all children will have been investigated by the age of 18. And in England, we don't have those figures, but my own study showed that 1 in 5 of all children have been referred to children's services, mostly for suspected abuse, and 6.4% have been formally investigated before reaching the age of 5. So what we're seeing is huge numbers of children drawn into the system. In England, it's probably going to go up to the sorts of levels of Australia and New Zealand by the time those children are aged 18. So we're seeing a huge increase in the numbers of children investigated, and we're seeing large proportions of the population investigated. However, it's not just any children that get investigated. What we know is that these investigations take place in mainly poor and deprived communities, and around ethnic minorities. So, for example, in America, it goes up to 52% of all children who are from African American backgrounds will have been investigated before the age of 18. That's more than half of all children. Similar sorts of levels for Aboriginal and Maori children in New Zealand and Australia. And here in England, what we know is that children are much more likely to be investigated and put on child protection plans if they're from very poor communities. So if you live in the lowest 10% of income in the country, you're 10 times more likely to have been involved with children's services, investigated or put into care than you are if you live in the highest 10% by income. The other trend that goes with this, hand in hand, is that there's a huge increase in removal from parents, and I'll look at that in more detail later. But basically all of these countries are seeing increases, and research that looked at 10 high-income countries found that all had increased the numbers of children in care, apart from the USA. And in the USA what had happened was there'd been a slight dip when large numbers of children were adopted out of care. That's now been reversed, and the numbers of children in the USA in care are increasing alongside adoption. Finally, these issues lead to or are associated with low levels of child well-being. In the English-speaking countries where we have this investigative approach, what you see is that none of the English-speaking countries with these approaches are in the top 11 of measures of child well-being in states. If you want to find out about where child well-being is high, you have to look to the Scandinavian and Northern European countries, where a totally different system of responses to children is in action. There, children and families are helped. The focus is on help rather than on investigation and trying to prevent abuse. So what families get is, regardless of their problems, what they get is some attempts to try to provide them with resources and services that will actually improve the family's ability to cope with their children. This is in stark contrast to the growing trend in America, England and the other English-speaking countries, where the approach is about trying to find abuse and quite often removing children for issues of neglect and emotional abuse. Most of this increase isn't about children who've been sexually abused or about children who have been physically harmed. This is all about trying to prevent the long-term damage that might be caused by children being neglected over a long period. Sadly, we've got very little evidence that this actually achieves this aim. I'll come to that again later. Sadly, there's not a lot of evidence for whether or not child protection systems actually reduce harm at the national level. It may seem obvious that they do, but what research there is goes against that. So, for example, Gilbert and colleagues carried out an international comparison of 6 countries, and they looked at what was happening with children aged under 11 who were suffering from either neglect or physical harm. And they tried to see whether or not there was any evidence that there was been any change in this harm over a period of 20 years because of changes in policy and responses. And here's their conclusion. They said, "Our results show no clear evidence for an overall decrease in child maltreatment, despite decades of policies designed to achieve such reductions." And if you think about it, what I've been showing you in terms of the continuing increases in the numbers of investigations means that whatever we have been doing in the past, it hasn't actually reduced the numbers of people that we have concerns about. A similar study by Trockme and colleagues in Canada looked at 2 cohorts of children, representative samples of about 14,000 each of children who were investigated in either 1998 or 2008. And what they found was that at a national level, there had been no difference in the numbers of children who were in need of urgent protection. That's children who have been sexually abused, children who have been had some physical harm that's required any degree of medical treatment, and children who are aged under 5 and who are suffering from neglect or sexual abuse or any of these other issues. So those kids where we need to urgently move in to protect them had stayed at about 36,000. However, all the other investigations, most of which were related to either minor levels of neglect or issues of emotional harm, had doubled. They'd gone from 100,000 to nearly 200,000 investigations in Canada. That's a huge increase in the numbers of children and families who are put through an investigation. And it led to a significant proportion of children who were receiving either ongoing services or who came into care having services because of issues of neglect. There is a real issue about whether this is the best way to deal with neglect and issues of emotional harm. Many of the problems that cause it, alcoholism, addiction, poverty, are huge problems which require a different sort of response. The stresses that make it difficult for families to actually care for their children adequately are not simply around the behaviour of individuals. They're around how do we actually provide services to them and how do we deal with social exclusion. I'll give you my own research on Western Australia, which shows how these trends have happened over time. So I helped to set up an information system in Australia where I am at the moment, working on it, that was in operation from around 1992 to 2009. And the figures I'll show you now are just for this shorter period, but they're just similarly representative. And what we see is that there's a huge increase and changes in the numbers of referrals and reports. They go down for a period, they go back up quite dramatically. And these changes can be related to changes in policy. Similarly, we see investigations taking that trend of upwards of an increase from about 2004 onwards. And again, there was a change of policy that was about trying to promote well-being, but more and more children became subject of investigations. Now, when it comes to findings that there had been some sort of abuse, what you can see is that there has been a slight increase, but it doesn't relate at all to the referrals and reports, and it only relates very slightly to the numbers of investigations. However, this is one of the few studies where we got social workers over all of that period to start to say what was the harm that had been found at the point at which they'd substantiated the abuse. And harm could be emotional harm, it could be around physical harm, it could be about the impact of sexual abuse on children. So we got social workers to categorise this. And what we saw was that there'd been no change in the numbers of children harmed. It's stunning that we see such a flat line, and we can take that line back another 4 years and see over around 20 years worth of social work policy changes, social work differences, but no evidence that we're actually reducing harm to children. And if you look at the size of that harm, it's a small number of the cases, and the serious harms are even smaller. So, for example, the proportion of children who were substantiated, who didn't go to hospital for any form of treatment, was over 96% over that period. So again, we're looking at relatively minor harms with the intention of trying to prevent future harm. And sadly, we've got no evidence that we're achieving this. I'll now look at the trends in separation in England. And here what we have is an interesting pattern. First of all, as you can see, over that 10-year period, the numbers of children adopted had increased by 42%. This is because we'd had a specific policy aimed at trying to reduce the numbers of children in care by having them adopted from care. Alongside this, we'd introduced a service called special guardianship, which was mainly aimed at promoting kinship care. And as you can see, that's gone up as well by nearly 30 times in that 10-year period from its introduction. Finally, what we have is that we've got an increase in the numbers of children in care of 21%. So despite having taken more and more children out of the care system, we've ended up with more children in care and more in adoption and in kinship care. So we've had an overall 52% increase in children separated from parents. This is a huge increase at a national level, going from 100,000 to over 150,000 children on any one day separated from their parents. So to recap on that, what we see is policies that were aimed to reduce the numbers of children who were taken away from parents, actually increasing them. So we increase the numbers in care and the numbers adopted and the numbers in kinship care and special guardianship. So now we can look at the outcomes of separation. And this looks at children who are in care in residential care, but also includes children who are in care in foster care. Foster care has some benefits, but it does not necessarily lead to better outcomes for children. So what do we see? Internationally, across the whole of the world where there is research, we see poorer education outcomes. It's usual for children who've been through the care system to have lower exam results and less ability to actually engage in higher education. We also see issues of crime. Large numbers of the children who've been through the system are involved in crime and criminality. You'll see that a large proportion of children in prisons in many different countries have a background in care, and here in the UK, a large proportion of all juvenile crimes are committed by children actually in the care system. Children who leave care frequently are unemployed or in poorer jobs, so they're less likely to earn good incomes. They're highly likely to be homeless. Many have problems of mental health. They may even have lower levels of people reaching the age of 25. Studies in Sweden and Norway have shown much higher mortality before the age of 25. There's also a risk of suicide, with very high rates of children who've been through the care system committing suicide, much higher than for children who've not been through the care system. Children within the care system are at risk of sexual exploitation. Here in the UK, we've had several sad situations in which people have been sexually exploited, groomed, used for prostitution, while still within the care system. Many of our scandals that we've seen in recent years have predominantly been of children in the care system, although other children are also involved. The children themselves are highly likely to become pregnant on leaving care, or at least the girls are. Their own children have a high risk of being in care or of being adopted. So, for example, in Wales, the numbers of children who were adopted in 2014 who had a parent in care at the age of 16 was more than 1 in 3. That's a third of all children who were adopted across the country had a parent who was in care at the age of 16, a care leaver. So we're seeing that the problems of care are actually self-perpetuating. Many of the people who face coming into care are themselves people whose parents had care histories. Similar research about children who have multiple sets of care proceedings in England has shown that 40% of parents who had multiple care proceedings had themselves been in care. So again, care doesn't seem to promote people's ability to be able to be good parents themselves. There's some studies which show that the IQ of children in large children's homes is actually lower than children in other placements and children who did not enter care by about 20 points. Finally, there's all sorts of other issues: involvement in drugs, prostitution, autism, children who come into care very young, for example in Romania and Bulgaria and Eastern Europe, are highly likely to suffer from autism, and this seems to be caused by institutional care. And to sum this up, what the UK Parliament said was that outcomes are poor even when compared to children with comparable backgrounds and problems. So we're seeing an institutional effect, an effect of coming into care. And I'd repeat once more, this isn't just simply about children in residential care. It's all forms of care are having many of these poor outcomes. So what can we do to make a difference? How can we do something else? I want to talk to you about an approach which I call social development, and this is a different paradigm for doing social work. So what are the key features of this? The first is that we actually directly address the problems of poverty. We do things that enhance people's capabilities, including maybe placements in employment, providing childcare so that parents can take up employment. We do things about adult literacy. We try to provide micro enterprises and asset savings accounts so that people can benefit from their income, which is a real problem for many people in poverty. They also have great problems in getting loans, so they're much less able to be able to get by themselves out of difficulties. The second thing of a social development approach is that it's advocacy oriented. It's moving from a narrow preoccupation with practice with families and children to start to say we want to try to bring about broader changes. David Tobis will be talking to you later in this conference about how parents and their allies in New York managed to reform the New York child protection system and reduce the numbers of children in care by a huge amount, from 50,000 to around 9,000, if my memory serves me well. So advocacy is a crucial element and is one which social work should be involved in. I've just done a literature review on programs that provide parents who've been through the child protection system, who've maybe had a child removed themselves, who've had a drug problem, and who are then trained to help other parents to deal with these issues. There's really encouraging evidence that this is an approach which offers a real difference, that parents who are having difficulties see hope to get through it. They see somebody who, like themselves, has faced these problems and realize that it is possible to change, and they start to make a difference. So for example, some of the programs deal with people who've had drug and alcohol problems, and being paired up with a parent who's come through a drug and alcohol problem can actually lead to more sobriety and can start to help them to keep their children. And there's now starting to be quite a range of evidence on this. But we shouldn't individualize. The current system individualizes everything. It's all about individual parents, and we need to be much more community oriented to find ways of helping parents within their local communities to combat the problems they face and combat the problems of poverty and social exclusion. This means we need a very strengths-based approach to communities, and to be able to start to make sure that parents are supported within their community, and that they have the resources in that community to make a real difference. Finally, it's got a strengths basis. As I said earlier, the whole of the current paradigm in social work in the English-speaking countries is one that focuses on difficulties and weaknesses. And what we need to do is to look at where families can cope, where communities can cope, and start to promote resilience and start to promote the strengths of people. Until we do that, we'll continue to have this focus on the individual rather than looking at the wider issues which make parenting more difficult. And what that needs is an interdisciplinary focus. We need to be working in areas of housing, of medical care, of education, of recreational facilities, of transport, of all the things that can make life easier for people who are struggling to parent. Because at the end of the day, we need our children to do well in our countries. And what we need to do is create environments in which they can do well. And social work should be a key part in developing those environments. So, a final word. What we've seen across the international community is a move towards a much more investigative orientation, which is about looking at issues of neglect and so on. And that this has no strong evidence base for it, that it is leading to many families being damaged by having been investigated, which puts real stress on them. It is having the effect of more children being separated from their parents, whether through coming into care or being adopted. And the outcomes are not good. So we need a change. You're here to make that change, and I'm so pleased to have been able to talk to you. Thank you.